Webinar long and prosper, Sarah.
Getting alignment on any technology within any public sector, private sector is difficult because I think everyone has their own preconceptions about what it is.
We can always converge to one single point when both the teams are aligned on the same common pathways, that is according to the patient's narrative.
I think that a lot of people get caught up in the mechanics of their role and they forget about the purpose. But when they're reminded on the purpose and when they can align with something that is deeper than code and spreadsheets, then they become a lot more inspired and creative in how they approach the problems.
Our team very quickly started talking about like, okay, what's our stack? Can we do this? Can we do that? But then there was a very conscious point in our conversation where it's like, we're going down this tech rabbit hole. We really should take a step back and do what is very simple, but extremely difficult in my experience, which is seek understanding, right? It's very easy to get into the problems, and I'm a geek, right? And so I enjoy the technology, the deep problems there. But taking a step back and saying, what is the problem we're really trying to solve? And
the alignment challenge is not about the capability, it's about the assumptions. Because clinicians, healthcare team, and developers all thought they were solving the same problem, but they were optimizing different things. So what helped was slowing down early and being very explicit about three things: whose decision we're supporting, what constraint we had to respect, and also how we translating between the teams to have a common language so we have a common goal. So once those things are clear, alignment stop being a constraint.
You're working with different teams, different perspectives. Everyone's coming from a different angle. We want alignment, right, across the team. But at the same time, we want to inspire creativity, because without creativity, you can't create solutions that haven't been there before. And how do you communicate that? You have to create that culture where everyone is met where they are without judgment, and everyone has the freedom to communicate and is given that creative freedom.
Can be subject, or we can be the ones who decide how to use it.
So alignment is not agreeing on a meeting. So over promising happens on that table. So alignment is what? When you model breaks at 2 a.m. So you're running a system, it runs perfectly on the slide, but at 2 a.m. it's everything crash. When the data pipelines get stalls and basically clinicians ignore when there's an alert comes, when nobody knows who owns this failure. There's no dashboard can save patients. No accuracy can save patient. There's no roadmaps and slide decks and promises can save patient. The value appears exactly at one moment when a human changed behavior.
If you can sit there and overpromise and say that, hey, we're going to deliver this solution to the payer market and the hospital market, we're going to get this many sales, this much MRR, and our sales cycle is going to be 2 to 3 months, and they give you a check, you should run away from them. If they offer you that check, you should run away from them because it shows that they don't understand healthcare. And you're going to be in a special type of hell.
What health means to a nurse and a doctor and an administrator or a chief financial officer are also very different, even when you look at the applications of AI. But what we realize is when people come from different cultures, they have different expectations and definitions of health. Those perceptions of healthcare can lead to a very different definition of how good or bad healthcare is.
Their role as a physician is in no way sabotaged. Their clinical insight is in no way being challenged.
The clinician come to us like, what if you mistriage someone, or what's your missed signal, and who's going to be reliable? So it can deviate the main conversation from what actually this technology can provide.
They want the benefits now. They want the short, straight paths to success, and their wanting it should be enough to make it happen in their mind. The fuel that AI depends on, and that's patient data. And right now, what we have available through the common sources like PubMed and clinicaltrials.gov and others, is enough to get us to, I guess, those first turns and stuff. But eventually, that's not going to be sufficient enough.
The question we really haven't really got to grips with is who is driving the car? Like, if the tech company is driving the car, will the clinicians be happy with that? And if the tech clinicians are driving the car, will the tech companies be happy with that? And what happens if the clinician crashes the car? But also, it's actually hospital management or managers in the institutions. They're the people who buy the car. And they're not driving it, but they certainly want to decide what the specifications of the car are. And finally, we've got the patients as well. Well,
Overpromising is the name of the game when it comes to investment.
We do have to think about how we accumulate the data safely. We are using a repository in the US for our data, Palantir, and Palantir is an organization we're anxious about because we don't know just how safe they are.
The government took over for the citizen the development of EHR systems where they can use. It's voluntary, so you can use it or not if you are not confident on the security or whatsoever. So this is the way it was handled. And like Angus was saying, this is clearly the property, the data are the property of the patients. And they can share their data with one or another hospitals or academic based on what they are informed about. And so the government ensure the security and the confidentiality of the data because the servers are in Switzerland, the security is developed in Switzerland, and so on. And I know that currently in EU, this is also the path they are following. And I've seen an initiative called X-Share by the EU Commission, where they want to develop a similar idea. They are currently advertising on the yellow button, meaning to give the power to the patient to click on the yellow button to share on their data.
If someone withdraws their consent, you can't just remove the data and lose its imprint. It's kind of there forever, as long as the system is running. And so what does that mean for what consent really is?
I think actually a lot of tech consent forms are a contract.
Yes.
It's just like you're giving the consent, which means we've got it now. You didn't understand, maybe, but we've got it legally. We have and you're actually entering into a contract, but it's phrased as consent.
Information really needs to follow the patient. Currently, for the AI side of parts, we really need to be certain that we don't create more papers and reports with statements saying that they are facts. We really need to back down and start understanding what research has really been done properly from methodology to math, right? Otherwise, we're going to be in such a pickle within 3 or 4 years.
Takeaway from today, I would say great technology fails quietly without alignment. But when alignment is designed in, even simple tool can survive and have real impact.
Sarah Bundy, hailing frequencies are open.
Yeah, I mean, I think for me, it's just about alignment, building trust, and working together for the same outcomes. I mean, I think I said that before. Just making sure you're all on the same page, and the most important thing, and I've said this on other webinars that I've been on with you, is putting the patient first. We talk about investment, we talk about sharing data, we talk about this, we talk about that. The patient must come first. When you're working in healthcare, the patient has to come first, and that's it.
Building the right culture where patient comes first and there's trust provided by default, and people are allowed to be creative and express their creativity. Without that, you cannot create new solutions. And patient comes first. Absolutely.
No growth without governance. People look at governance as a bogeyman that's a blocker to innovation, but the right standards and the right science backing allows clinicians, allows hospital decision makers to be able to look at your processes, to understand the algorithms and the risk factors that they're purchasing. That transparency helps with that other word, trust. And ultimately, like if it's just a hodgepodge of solutions and tech without any governance, you're going to lose the interest of people who are taking patient lives and risks, licenses, lawsuits. All those things are extremely serious, and you need strong governance to protect your clients against that.
The lawyers will have the final word.
I'll come from the opposite side a bit, but I'll say that I believe that in about 10 years, we're going to look back and see that nothing has had as much of a positive impact on healthcare, on health equity, and access to care and quality of care as AI would have had on us as a society. We are going to go through some difficult times. There will be jobs lost. There will be big mistakes done. There will be people using it for the negative purposes, but ultimately the impact it's going to bring on us is going to be tremendous, especially today when you have so many that actually today we're talking about nurses and doctors wanting to use AI software. There are millions of out there that don't even have a doctor or a nurse. And they would need something like AI, and those would stand to benefit the most.
Thank you. John Paul. You're muted.
Oh, sorry. Sorry, I wasn't expecting. I think you have to kind of build trusting relationships over time, and that means doing what you say and being dependable, being reliable, and being that person who's there when the people are in trouble. And if you back people when they're in trouble, the partnerships emerge. If you go, it's not my problem, or we'll get back to people later, or promise something you can't deliver, you've lost that. And in particular with clinicians, they talk to each other, they know each other. So their reputation isn't just in that relationships, it's the people they know as well. So you have to be dependable. And if you're dependable, they will tolerate things going wrong because they know you're there to fix it.
Thank you. Paolo, are you there?
Yeah.
Paolo.
Yes. Yes.
Can you say something in less than 30 seconds?
Yes. I think the key is safety, safety, and safety, and patients are us.
Thank you. Miller, final minute. Sorry, final minute.
Yeah. So yeah, thank you so much everyone for joining today, and it's amazing. And my final thoughts, if it's like a engagement and alignment between a company, tech company, and the healthcare industry, I don't think it's not be the case. So it's all about what service, what was enabled, and how the patients or the people got served on that. So don't measure AI by accuracy or promises and so on. Measure it by the change of decision, and that's the real impact. So that's my final word.
Thank you so much, everybody, for joining us. I'm going to get into the video editor and chop you up all into little tiny pieces and distribute on LinkedIn.